Hello, welcome back. Steve's Retirement Corner. Health insurance options for retirement. Past couple months, I've had a handful of questions about what I did for my insurance since I got a few years before I qualify for Medicare. I've gotten a few new subs since I done my last video on it, which was last late spring or early summer of 22, I believe, before I left. I just figured I'd update it and give everybody an idea of what I chose and why. Health insurance is something that's important. It gives a lot of people a pause when they decide to retire, especially if they're not 65 yet. You know, it's expensive. And after getting insurance from work for all them decades, man, it takes a lot of, it took me a lot of discovery, a lot of investigating, a lot of figuring out in order to figure out what I wanted to get. I'd originally planned to go with the Obamacare because of the premiums I could get at where they give you it's a discounted rate according to how much you make. The premiums were so low, the monthly premiums were almost nothing. The amount I got to pay now, but I went with my retiree insurance from work. It's the same insurance I had when I worked at the same premium monthly. I don't have to cover the whole cost of it. If I had, I'd had to go to Obamacare like I originally planned. But it's like 2.5 times a larger premium than the Obamacare was. But where they get you at is on the backside. Is if you have to use it, then you got to come off some scratch, buddy. And that's what I was looking to avoid, coming off that big payment if I had to use it. Now that $700 is what I pay. Well, it's $730 now. It just went up. But that $700 I pay is expensive to me. It's a lot of money compared to what $241 and $239 is what them two gold Obamacare plans were. But the maximum amount of pocket for them were like $17,400 for a family and whatever that $8,700 for individual. Mine's like it's $3,000 for a family and $1,500 for an individual. And the deductible for mine is like $600 for a family and $300 for an individual. I don't have to come off as much on the back end as I would in them Obamacare plans, because they were like $4,000 for family and $2,000 for individual. But another thing is I wanted to keep my doctor and I wanted to keep they covered my blood pressure medicine. By staying on my plan, I could do both of those. And for those Obamacare plans, I could too. That's why I picked those two. Those are the ones I was looking at. Jae Oh, Jae This is my little black book for retirement planning and questions I keep beside my chair at the house. That Jae Oh is, y'all follow Josh Scanlon in Heritage Wealth Planning. He done a live interview with this guy 2 or 3 years ago. He's done it a couple times. Last one was 2 or 3 years ago. But he's a Medicare expert and he's a financial advisor. And he was talking about a website when he was on there the last time called Health Sherpa. 2 words, HealthSherpa. It works just like your the healthcare.gov website or whatever. Helps you sift through the plans and figure out which one's best for you. I use that site a lot, that Health Sherpa. The guy's smart. He knows his stuff. I'm sure you got an expert somewhere closer to you that you could probably go to and talk in person. If nothing else, get an insurance agent and go over it with them. It's what I did. But I use this site a lot. If I get a chance and figure out how to do it, I'll put the link to this video from Josh on the description. Oh, and I'll put my video, a link to my video, my last video on my health insurance up in the corner somewhere. But so that was just a little information. It can help you with your, if you're getting close to Medicare, figure out what might be your best option on there too. So, but you got some of the other options were a health sharing account. some people I know, just one or two, but they like that. It's a cost savings for them. You got to remember, it's not insurance. It's a health cost sharing is what it is. Plan is what it is. There's a lot of you got to qualify for it, and there's some things that they require you to do when you get if you do it. Some stuff they don't cover. I don't qualify for a lot of it. Some of them that I did qualify, I wasn't willing to give up what I was able to get for this. So that's the reason I didn't take it. You can get an independent policy. At the time I was looking, you can still get a regular health insurance policy on your own. But like I was talking about, the company pays 3/4 of my cost of my insurance. I only get paid a quarter of it. So it's I couldn't afford to buy the whole policy on my own. So it really wasn't an option for me either. Same one for the next one, being a spouse. Spouse wasn't an option for me because my wife didn't work outside the home. I didn't have somebody else's plan I could go on. But it's an option if you have a spouse that's not retired yet. And it could save you a lot of money up front. Self-care or self-insure. That, to me, that's gambling. I'm gambling that from now until I'm 65 that I won't have to use it. I mean, 2 or 3 nights in a hospital one time is going to be right expensive. By having health insurance, I don't have to come off the whole money, all of it. And that's what I was looking for, coverage. Coverage, and it gives me peace of mind where I don't have to come off 15 or 20 grand all in one shot. One time, cool, I'm all right with that. 2 or 3 times in the next 5 or 6 years, it would upset me. It'd be hard for me to come. I mean, I could do it, but it just wasn't worth it for me. A lot of people are fine with that. If you are, hey, knock yourself out. I don't care. I wasn't, so I didn't go that route. But it can save you a lot of money if you stay healthy. The older we get, chances of us staying healthy go down. I've seen too many people go in for minor things that end up staying in the hospital 2 or 3 nights. And I wasn't willing to take that chance. Simple as that. And state Medicaid. You might be able to get on a state Medicaid plan. But that's income specific. So if you make a certain amount of money, you don't qualify. But it is an option if you can figure out how to make it look like you got less money. There's a lot of options out there. It just takes a lot of work to figure out what you qualify for and what will work for you. What you're looking to get. I was looking for coverage. Some people looking to get the cheapest plan or cheapest monthly payment or whatever. I was looking for less money out of pocket if I had to use it. So, I'll put that, I might have said that already. I'll put that video of mine up in one of these corners, and I'll put Josh's video link down in the bottom. If nothing else, I'll write down Jay's name and I'll put in that daggone Health Sherpa website. You can pull it up. But there's a lot of options. It's a lot of work to find it. It just was for me, and I don't know enough about it, so I still had to go talk to people about it. I'm in what I think might be my winter headquarters. It gets windy out there, snow and ice and rain. So it's over a little old shed over at Mama's. I just finished cleaning out. Had all Dad's junk in it at one time. So we'll see. But y'all take care of yourselves. You enjoy the rest of your week, and we'll talk to y'all later.